Good morning to all. I am Prof.Manavalam. Now we are going to see about the third stage of labor.
Good morning, and today we are going to see about the third stage of labor. So what do you know about the third stage of labor? Anyone? Placenta separation. So third stage of labor, it is a period, it starts from the after delivery of the baby to the delivery of placenta with the membranes. That is called as a third stage of labor. During the third stage of labor, certain events that takes place. So first one is separation of the placenta. The first event that takes place during the third stage of labor is separation of the placenta, followed the delivery of the placenta. Next, controlling of the hemorrhage from the placental site. So they will take the measures to control the bleeding that is happening in the placental site. So that is called as a control of hemorrhage from the placental site. Followed the initiation of breastfeeding and also providing the immediate newborn care. So these are all the things that is happening followed the third stage of labor. So mainly we are going to concentrate on the separation and the delivery of the placenta, followed the how the hemorrhage, prevention of hemorrhage that is happening during the third stage of labor, that we are going to see in detail. So how the separation of the placenta starts means, so after the delivery of the fetus, so uterine contraction, it is continuously happening throughout the labor. This is the unique characteristics of the uterus. So the contraction and the retraction is the unique characteristics of the uterus. So mainly during the time of the placental separation, the power of retraction is more. The power of retraction is more in the uterine muscles. At the same time, the power of uterine muscles which will be getting increased during the end of the second stage of labor, followed the initiation of the third stage of labor. The power of retraction which will be getting accelerated in the myometrial portion of the uterus layer. So myometrium means it consists of muscle layer. There only the power of retraction which will be increased after delivery of the fetus, which aid for the separation of placenta. So during the power of retraction is shortening of the uterine muscle fibers. So during the retraction, automatically the placental site which will be getting diminished 75% because of muscle retraction. The placental site which will be getting diminished 75%. Because of diminishing the placental site, the placenta it will be getting compressed. The placenta it will be getting compressed. Once the placenta is getting compressed means automatically the blood vessels it is running through the placenta, it will be get cut, and also the blood that is present in the intervillous space. So the intervillous space, you know very well, I think so. The space between the placenta and the maternal surface, blood vessels, the space. So the blood from the intervillous space, it will be entered into the spongy layer of deciduum basalis. Spongy layer of deciduum basalis is where the placenta which will be getting attached in the maternal surface area. So that area, the blood which will be getting entered. This is the one process. Second one is the oblique muscle fibers. The oblique muscle fiber, it is going for retraction process. The oblique muscle fibers, it is going for retraction process. Once it will be getting retracted means automatically the blood vessels which will be running through these muscle fibers. So blood vessels which are running through these muscle fibers, it will get intertwined. So it get intertwined, or otherwise it is called it get compressed. So once it will be getting compressed means automatically the blood which will be not backflow, it is not further, it is backflowing towards the maternal surface. Are you clear? It is not backflowing towards the maternal surface. At the same time, what will be happening in the blood vessels means it get tensed and congested. So once the pressure which will be increased because of contraction and retraction process of the uterus, the pressure continuously get increased in the uterus. So automatically after once if the blood vessel will get congested means it will get burst and it is torn out. Are you clear? It is bursted out. So the bleeding which will be started to flow from that third blood vessels. So this is the things that is happening while the placental separation. So the placenta usually is located either anterior or posterior part of the uterus. So nearly this present in the frontal, near to the corner of the uterus. It is present in the near to the corner of the uterus, either posteriorly or anteriorly present. This is the normal location of the placenta. Okay, if it is sometimes it may be present in the upper segment, that is in fundus, or sometimes it may be present in the lower segment, then it is called as a placenta previa. So okay, normally it is situated in this area, either anteriorly and posteriorly. The placenta, it will be getting separated by two methods. One is central method, or otherwise it is called as a Sculls method. Second one is lateral method or marginal method, otherwise it is called as a Matthew-Douglas method. How this process of separation which will be happening means, first, initially the placenta, after delivery of the fetus, the continuation of uterine contraction and retraction which will be present. The uterine contraction in the fundal, so it will be exerted over the placental area. So already I explained the previously what is the things happening in the rodal muscle fibers and the power of retraction. So first in central method, usually the placenta starts to separate from the lower pole of the uterus, and it is gradually going towards up. Okay, the separation process. So in case of central separation, first the process of separation, it starts from the center of the placenta. It starts from the center of the placenta. So the placenta which will be detached from the maternal surface. The placenta which will be detached from the maternal surface from the central area. Once it will be getting separated means automatically the blood vessels which will be getting opened. Are you clear? The open, so the blood which will be getting collected and forming as a retroplacental clot. Forming as a retroplacental clot which will be forming in the center. So once the retroplacental clot which will form means automatically it is exert pressure over the placenta. It exert pressure over the placenta, and also the weight of the retroplacental, it is present in the center. So it exert pressure in the midpoint of the placenta. It exert pressure in the midpoint of the placenta. If it is exerting pressure in midpoint means automatically the lateral side also, because of this weight, it will be sheared up from the attachment. Are you clear? This detaching from its attachment. So automatically this gravity of weight, it will be pulling down the placenta into the vagina. Are you clear? The central method of placental separation. In this method, it took place in very short period of time, and also the blood loss is very less because the clot first. Initially the clot which will be forming, this clot only aiding for further lateral separation of the placenta. So as a whole it is coming out. First we will see the placental surface in vagina. By vagina we will see the placental surface at first. Are you clear in this method? So next method, lateral or marginal method, or otherwise called as an Matthew-Douglas method. In this method, the placental separation, it starts unevenly from the lateral side, unevenly from the lateral side. It's not an even one, it is unevenly, it starts from the lateral side. So it starts from downward and it's gradually going towards up. So while it is starting from downward, automatically the blood which will be coming out through the separated layer. So we can see the visible blood outside. Are you clear? Clear. And also there is no chance of forming the retroplacental clot because laterally it will get separated. So it has the space. Through this space, the blood which will be coming out without formation of the clot. So it will take some more longer time period for its separation because no clot which is exerting pressure, no weight which will put down over the placenta for further aiding of the separation. So for this reason, it will take some more time for separation. In this method, first we will see the maternal surface. First we will see the maternal surface out. So this is the two method of placental separation. Seminal method as well as marginal method. So next process is called as hemostasis. How after separation of this, how this hemostasis or control of bleeding that is happening. Normally in the placenta 500 to 800 ml of blood which will be getting circulated per minute normally, but automatically at end of the second stage it will be getting reduced. The blood supply to the placenta because of the continuous contraction and the retraction process, the blood vessels which will be supplying very less amount of blood to the placental site. So this is the reason. So how the hemostasis which will be taken in means by three methods. First one is retraction of the oblique muscle fibers. Retraction of oblique muscle fibers. Next, vigorous uterine contraction and retraction. Third one is breastfeeding. The early initiation of breastfeeding. So three mechanism is very much important to control the bleeding during the time of placental separation. So first, how it will be retraction. The uterine, oblique muscle fibers, that is, it will be circulated around the placental site. The oblique muscle fibers circulated around the placental surface area. Once the placenta is started to separate, that means this oblique muscle fibers, it will be retracting. So the blood vessel which will be running through this oblique muscle fibers, running through this. Very clear. So it is running through this. So once the muscle which will be contracting, it automatically it will intertwine the blood vessels. It is intertwine the blood vessels. Very clear. It is intertwine the blood vessels. So further, automatically the blood which will be stagnated one side, it will be gets congested. Further, it will be get ruptured. Once it ruptured means this muscle fibers, it is sealing the, it is act as a clamp over the opening of blood vessels. It is acting as a clamp over the opening of blood vessels. Are you clear? Because it is surrounding the blood vessels. The oblique muscle fibers, it is surrounding the blood vessels. Are you clear? So this is one type of mechanism. Second one is the contraction and the retraction. The contraction and the retraction further which will be aiding to contract the blood vessel. So automatically the supply of blood vessel it will be cut down. Very clear. Contraction and retraction, it will be make a congestion over the blood vessels. So further it will be cut down the blood supply to the vessel area. Next one is one more thing I forgot, activation of coagulation factor. So activation of naturally the antenatal period is a hypercoagulable stage. So they are having the high number of coagulation factors in them. So the fibrinolytic activity will be enhanced at the time. So the fibrin mesh which will be getting formed, this fibrin mesh it is automatically covering the open blood vessels. It's covering the open blood vessels. So if it is covering the open blood vessels now, what will happen? Further there is no chance of bleeding from that side. The tortured or open blood from the open blood vessel, there is no chance of further blood loss. So this is one thing. Next, breastfeeding. So the early initiation of breastfeeding, why they are giving more importance over on that means because of breastfeeding, what hormone which will be getting stimulated or produced? Breastfeeding. During breastfeeding, which hormone? Oxytocin. So oxytocin which will be getting stimulated and it is produced. The oxytocin is the essential factor for lobular contraction. So we are breastfeeding, that is the first initiation. Prolactin it will increase the breastfeed. So first the oxytocin is very much essential for contraction of all over the muscles. That's a present in the uterus as well as the breast. So the early initiation of the breastfeeding, it initiate the release of oxytocin. It will initiate the oxytocin by increasing the contraction and retraction power of the uterus. Are you clear? So the oxytocin further, if it is increased, means the contraction and retraction process which will be enhanced. Automatically it will be act as a natural mist over the living ligature over the blood vessels. Through the blood bleeding which will be getting controlled. So that's all about the placental separation process and how they are controlling the bleeding. Are you clear? So next, how they are delivering the placenta means they have to wait 15 minutes after delivery of the fetus. They have to wait 15 minutes period of time for spontaneous delivery of the placenta. So for spontaneous delivery of the placenta, certain signs we have to assess. So usually the mother used to have the contraction. So the contraction, we can feel it when touching the uterus by abdominally. It is very tense, hard, and it is palpable. So like that, mother will have the pain over the lower abdomen as well as back. Mother used to have the pain. And also the signs of placental separation, it will be initiated. We will see the gush of blood that is present through the vagina. That is one of the signs. Next, lengthening of the umbilical cord. Lengthening of umbilical cord also present. So these are the signs of normal placental separation. Once the placental umbilical cord we are seeing in the vagina, means follow that we have to make a mother in an upright position. Why we have to make the mother in an upright position is because of the gravity. It will push down the or it is pull the placenta down. So for that purpose we have to maintain the upright position. Follow that if once if it is getting delivered, just we have to press downward press and we have to deliver the placenta and we have to check the completeness of placenta and the membranes. That's all about the placental separation and its delivery. Are you clear? So anyone answer to me, what are the two methods of placental delivery? Two methods. Anyone? Stand up until. Central method and a marginal. Very good. So do you have any doubt? Thank you all.
Thank you, ma'am.